Hello, so this video is about Northeast Occupational Exchange, or NOE, here in Bangor. So their mission. Northeast Occupational Exchange exists to assist persons who are physically and mentally disabled and otherwise vocationally handicapped to maximize their independent living capability, eliminate abuse and dependence on substances, and enhance employability and economic independence through the provisions of integrated personal and social adjustment training programs, advocacy, vocational, educational, and psychological assessment, psychological services, residential services, community placement employment programs, and substance abuse services. Northeast Occupational Exchange accepts Medicare, Medicare, private insurances, and self-pay. A sliding fee schedule is available upon request, so you'd have to please contact their billing office for more details on that part. So this is the history. Northeast Occupational Exchange is a licensed mental health and substance abuse agency serving adults, children, and adolescents. Began out of necessity in November of 1975. Dr. Charles O. Tingley, a psychologist, founded NOE and remains as CEO and clinical director. Mental health consumers were an essential part of the initial program development and incorporation group. These individuals recognized the need and wrote the mission and bylaws of NOE as they exist today. Sharon Greenleaf, CRC, MAC, LCPC, NOE's assistant director, has been with NOE since March of 1976 and can attest to the many fundraisers that help keep the agency afloat. We had car washes, bike-a-thons, bake sales, anything we could think of, she said. It wasn't until the early 1900s when NOE received its comprehensive clinic license that they were able to access additional funding resources. In the early 1900s, NOE's adult outpatient community support, day treatment, dual diagnosis, and substance abuse programs and parenting training began to develop and expand. Children's services began with outpatient and have expanded to family and community support, case management, and day treatment over the years. This is an area of great need, and many demands are made on these services, said Tingley. Prevention at all levels has been a priority across NOE's intervention strategies. Youth and families come with established problems. Behavioral planning and treatment program is necessarily early intervention and emphasizing secondary prevention efforts, entailing working with youth, families, parents, and adults in a treatment matching methodology. This helps people through the early clinical needs assessment and goal setting process and links them to relevant, empirically validated treatment services. NOE continues to deliver much needed services to many consumers. We offer offices throughout Maine. NOE's quick access referral and no waiting list policies accentuate the true spirit of prevention at all levels. Consumers are offered treatment along with extensive continuum. Persistence, consistency, and timelines are guiding principles, and we always exchange interest and motivation for practical knowledge and skills. So, referral and intake quick access starts here. NOE has an open door policy, so we do not reject or turn away anyone. We will work with the consumer at whatever capacity necessary to ensure that the individual or family get the services that they need. No wait list, quick access. Over the phone or in person, a service representative in our intake department will be happy to go over all our services in detail, collect basic demographic information, and establish a method of payment for services based on the health services needed. Sorry, there's a little spelling error there. An appointment will be made, then be scheduled for the consumer to meet with one of our licensed clinicians. When calling or coming in order to get services in the most effective way, consumers and/or referral source will need to have a social security and insurance information available. So clinical services, they have counseling, individual mental health, individual substance abuse, group, couples, and family for all ages. Assessment and testing, psychological, neuropsychological, pain, substance abuse, vocational, educational, violent, parental capacity evaluation, and child and adolescent behavioral evaluations. Clinical groups, parenting, anger management, dialectical behavior therapy group, emergency services 24 hours, 7 days a week. Community support services. Our community support services include a day program. This is a day-long treatment program designed to help people with ongoing physical and mental health conditions learn new skills to live fuller, healthier lives. Groups are designed to teach independent living skills, personal and social skills, pre-vocational skills, community integration skills, and communication skills. They also have intensive outpatient programs, substance abuse, group programs designed specifically for men and women to understand the dynamics of co-occurring disorders, managing stress, withdrawal symptoms, recognize and manage relapse triggers, and learn to use relapse prevention. Community integration services. This program is designed to educate individuals and bring people together so they will learn how to sustain within the community. Case managers are a resource to assist individuals to access community resources and coordinate your needs in life. We help link individuals with services and service providers, monitor individuals' well-being, and developing personalized and manageable goals. The program centers on the following aspects of life: housing, finances, basic needs, social relationships, emotional and physical wellness, vocational skills, and learning leading to direct integrated job placement. Independent living services. The Independent Living Services Program assists people who have significant disabilities to live more independently in their homes and communities. Behavioral health home services. A team approach involving your participating primary care provider to help people with chronic health conditions learn new skills to live healthier, fuller, healthier lives. And this is their contact information if you want to pause here and fax them, telephone number. Anyway, thank you for listening.